Welcome everyone to this much anticipated live broadcast
months in the making
of the reveal of the clinical trial results that was performed by the beautiful ladies from IPL, Innovative Pet Lab, using our Feline Essential IBD and Gut Health Restore Kit. This, guys, is we feel so blessed and so honored to be able to be a part of one of the first ever clinical trials performed on cats specifically. We're so grateful for everyone that participated in this endeavor, and also for Innovative Pet Lab for reaching out, agreeing to be a part of this. You guys did the whole freaking thing.
The whole thing.
But
this is just an incredible experience to be a part of this kind of study just about cats, 3 months long with 30 participants. I mean, it's something that you just don't see in the cat world. So we're so grateful, like Jay said, to everyone that committed to participating in this, for all their babies, and for IPL, who has done all the science and the hard work behind it. So let's start off with a quick, we're going to get right to the results. We're not going to keep you guys waiting too long, but let's start off with a little introduction of these incredible humans.
And the clinical trial as a whole. Yeah.
Yes.
Let's start with you, Jamie.
Hi, everyone. Nice to meet you. And thank you guys so much for actually including us in this. So I'm Jamie Smith. I am one of the co-founders and the CEO of Innovative Pet Lab. I have been in the diagnostic world for more years than I'd like to admit, and came from human and now into pet, and really taking the approach with our pets. And but using what we learned in human healthcare and helping to do it in the pet world is just so important to us. And this trial, I think when you see everything, it speaks volumes as to why and how and what we want to do. But really it's just very grateful to be part of something like this. So thank you guys for thinking of us and including us and all of that. So
we love you girls so much. Lacey.
Yeah. Hi, everybody. I'm Lacey. I'm the VP of Partnerships at IPL. And have been with the company over 2 years now, and thrilled to pieces to work with Jay and Adrian and help put together this study that is going to be tremendously helpful for the future of feline health. So glad to be a part of it.
So Lacey, tell us a little bit more about the study itself, how it was set up and what it was basically meant to explain to other people.
Sure. So what the study parameters were, we had 30 cats. Thankful to the community of all the people that applied. I mean, there were so many. It was really incredible to see the outpouring of people who were willing to help in this research. So we're grateful for that. We narrowed it down to 30 applicants who were going to participate in the study. And the parameters were that they would get a gut check at the beginning from our tests. We did both the inflammation and immunity test and the leaky gut test on all the cats. And then they were to be on the Feline Essential protocol for the 3-month period. And at the end, we would do a follow-up test to see the measurement of the analytes of those between those two tests. So that's kind of the outset, right? Very easy, not asking the participants to do any changes in diet or anything else, just add the protocol to whatever they were already feeding, so we could really see the efficacy of the product.
Yeah. So in a nutshell, they take the poop, they test it, they see how healthy your cat's gut is. We then, from the 30 participants, some with symptoms, some without symptoms, and we then give them our supplement, our kit, our IBD and Gut Restore Kit, and a protocol to follow to give to their cats every day, not changing diet, although diet is very important. It's just seeing what the supplements alone can do for the health of their gut. And then they take more poop and they send it back to the lab and they test the poop again. And then we get the results that we're about to share with you guys. So
I think the thing to even call out too that makes it so super unique and what's really exciting for you guys is that, you know, and like you mentioned in all their studies historically, not all, but majority of studies out there on these type of supplements, it's just anecdotal evidence, meaning I report some symptoms, you know, and we know that cats sometimes don't have symptoms. They're really quiet sufferers. But we match that too with actual data, which we'll get into, which I think is so critical because it's like they always say, the stopwatch doesn't lie, the data doesn't lie. And so you have two pieces of one self-reported, the true data to support the efficacy of your product. And so it's really exciting.
And it also shows just how amazing, when we first tested all of our cats with you guys, it was really incredible to see the differences. Even in a one family of cats that are basically all fed the same kind of foods and that sort of thing. It really is amazing to see the power of testing. And that's what we're really about to dive into in these results. So
yes, and we have a surprise for you guys.
And we have a surprise for you guys.
Okay, so I'm gonna go ahead and start and pull up the study results just in a nutshell, so that Lacey and Jamie can kind of go over everything with you guys, so you can better understand how this trial went. Okay, here we go.
All right, so based on the initial results from the majority of the cats, we saw evidence of leaky gut. So it's a term we're hearing a lot of now, which is great that we're talking about it more so we can help these kitties. Essentially, a leaky gut is where those barriers are broken down. They're not as tight. The junctures are not very tight. And when they're open, you can see that all kinds of things can get into the bloodstream. And that is really harmful for both humans and our pets. So when we talk about a leaky gut, that's what we're talking about. They're stretched out. They're not as tight as they should be. And so things are able to get into the bloodstream. Beep. So a primary marker for looking at leaky gut is zonulin. And what we found at the beginning of the trial there on the left, is that going to be the left when you see it? I don't know. The one that says beginning of the trial. 42% of the cats were normal. 21% had borderline zonulin, meaning they were creeping towards that problem area, already struggling, and 35% were high. So that's a really high number of kitties that were struggling with this leaky gut. The great news is, after the 3-month trial, just looking at zonulin, 73% turned into the normal range. Like, that's incredible. And then 13% were in that borderline, which is still good because some of those started at high. And so they're trending towards green, being good. And then 13% were in the high category. So really impressive results when it comes to strengthening the gut permeability there, which is excellent news.
Okay. And then a little bit more about zonulin specifically. And zonulin was one of many things that you guys tested, right?
Yeah. So we looked at, between the two tests, 4 different analytes: calprotectin, zonulin, anti-gliadin IgA, and secretory IgA. Now, you don't have to know all of those by any means, but we specifically handpicked these markers. One, because we worked with them in human medicine and we knew how they should perform. 2, they were well supported with literature, so literature specifically in pets. And so that was always really important to us, that 1, you had experience with it, and 2, that it was well supported through clinical trials and other validation. Specific to zonulin, it's kind of the gatekeeper for intestinal permeability. It modulates intercellular activity. Very fancy way of saying it helps keep those tight junctions together. So, like Lacey mentioned in that first slide, zonulin, it's a protein. It should help keep things here whether you're exposed to food issues, allergy issues, toxins, and those tight junctions start to open and those things pass through. Zonulin will also pass through, so we can measure it. And so if there's lots of zonulin and it's high, it's indicating that your pet has, or you as a person, have a leaky gut or intestinal permeability.
Sweet. Okay. And now go ahead.
Well, I was going to say, this goes into so many things when we're looking at what we would see from really high zonulin as far as being symptomatic, having issues. This even goes to having a strong immune system as well, correct?
Correct. Yes, because it can help, especially if it's being suppressed and being attacked. It'll help. It will cause intestinal permeability or a leaky gut to occur, and you'll see more of that zonulin passing through.
Awesome. And then overall, I don't think we have, we'll discuss that in the end. Here's something really exciting that I want to talk to you guys about. I'm just going to take this down for a second because we happen to have a special guest on right now. She's in the green room. I just call it the green room. We're just going to call it the green room. It's not green at all, but she's behind the scenes right now. We're about to bring her on because she is one of the trial participants, and she has a very we're going to bring up her cat Graham, his results through the process. But she reached out to us, aside from IPL, we didn't even reach out to her. She reached out to us and said, "Oh my God, guys, look at these results for Graham." And I will let her tell you the story so I don't butcher it. But please welcome Erin.
And many of you guys may know Erin from FC3 and amazing work that she does with TNR. Erin, very good to see you. Hello, love.
Yes. Oh my gosh. Okay, so Erin, tell us a little bit about Graham, why you got him on, why you decided to participate in the trial, and then a little bit about about your text to us that night.
Yeah. So I am thrilled to be here and share this. I am so passionate about proactive cat health, and to be able to participate and see the results has been just fascinating. So little Graham is about 3 years old. And I will tell you, when we found him as a little teeny tiny kitten on our sidewalk, brought him in, originally just going to foster him, but we adopted him, foster fail. And he was quite musical in the litter box. And we were fairly new to our holistic journey, and we're just kind of throwing noodles at the wall, hoping something works. Got him under control. He's on a good diet. He had healthy poops for what we thought. And then fast forward, I actually got to meet Lacey at Cat Camp in San Diego earlier this year. And so we connected and hit it off. And then this trial came up, and I looked at it and I was going to apply, but I thought he has no symptoms. Is he vomiting? Does he have diarrhea? Is he burping? All this stuff. And he had no symptoms. So I actually kind of disregarded it. But then I thought a little bit longer, and I was like, you know what? I'll just throw in my application. And I did, and we got accepted. We got the protocol. We started right away. And so it lasted 3 months, and Graham was such a sport. He took all his supplements. We kept a journal, and didn't know what to expect. We got the results while we're part of the protocol, and everything was in normal range except Zonulin. And it was high. It was over 6, and over 6 is considered high. So I was like, oh my goodness. And now I'm really glad we participated. So we did the protocol, and then at the end, we submitted another sample. We just got the results back, and everything still stayed within normal range, but it decreased. And then Zonulin had a significant decrease. It went from over 6 to 0.62. So we're super excited. He's still on the protocol. We're still maintaining it. And we have 4 kitties, and now all 4 kitties are on it. And all 4 kitties are probably going to go through sample testing too.
Yay.
I
I love this so much. So you didn't have a very sick cat, which many of the trial participants in the study did actually have some symptoms that they maybe have been to the vet, or they haven't been to the vet, but they've been trying to get under control. Maybe they haven't switched diet, but maybe they added little things, or maybe a lot of them were even on medication. We took a lot of what was it? A questionnaire with a lot of different questions about each different cat. And so you decided to be proactive about this anyway, because he did have issues in the past, even though he currently didn't have any symptoms, and found out that indeed he did have leaky gut, right? Girls, tell us a little bit about what these numbers mean.
Yeah. So at the beginning of the trial, we asked all the participants to complete a survey where they ranked a number of questions, but in particular symptoms. So on a scale of 1 to 10, how severe is the vomiting you're seeing? How severe is diarrhea? Is constipation a problem? All of these things. So you can see on the blue column there on the pretest, looks like Graham had a little bit of diarrhea, maybe some notable constipation, decreased appetite here and there, but we wouldn't consider anything under, 3 something that would be a significant issue, right? If we're on a scale from 0 to 10. So no symptoms really for us to indicate there's a problem. However, you can see on that pretest right there in red, Zonulin, 6.084. So through the course of the protocol, we gave another survey, kind of a midpoint. How's it going, for people to give their anecdotal data, tell us, this is getting better. This is, the same. the cat doesn't like it, my cat won't eat it, all the cats love it, whatever the data is. And then at the end, another survey. So over the course of those 3 months, we're able to gather that anecdotal data along with the actual resulting from the analyte. And then we could see the post-test, the leaky gut is resolved and Graham is good to go right now. So it's great.
I just love this so much because you were proactive about it. And that's something that most of us just don't do, right? And this shows the importance of being able to actually have a test, because these aren't tests that you can typically get at your vet's clinic, right? So you can go in and you can say, hey, my cat has these symptoms, and they typically will, do blood work, and then which blood work doesn't show leaky gut. And then they will prescribe some type of symptomatic medication, right?
Mm-hmm.
Which a lot of times these medications are actually in the long term harming the gut more than it's actually helping the gut. They're just there to alleviate symptoms like flagell, or these types of oh, my cat has some diarrhea. Metronidazole is a very common medication, antibiotic that they prescribe to cats and dogs that have antibiotics that have diarrhea. But the recent studies are showing that especially cats, also dogs, but especially cats, just one round of metronidazole can destroy their gut the scientists are showing almost irreversible. Certain things are irreversible. They cannot build back. And so that's why it's so important for us to try to find something that can help get to the root of the issue and resolve the issue. So I am so happy for Graham. I'm so happy for you. And I'm so proud of you for taking that proactive stance as a cat parent and doing that testing without waiting until you're at your wit's end and thousands of dollars in at the vet's office. So thank you so much.
No, thank you. Thank you all for what you do and having the test and having the protocol and the products. It's just been wonderful and amazing. I turn to the holistic approach as soon as I can, as opposed to, traditional chemical approach. So what you all are doing, absolutely amazing. Changing the cat health world.
Thank you, Erin, so much for jumping on and telling us about Graham.
Man.
Yes, thank you guys so much. Now, there's another study that we're going to be discussing now as well. I think I can change slides and then pull it up. Look, I can.
Wow.
Okay.
So this is another cat in the study. We're just calling them Cat 2 at this time. Protect his privacy. So this kitty, upon the pre-test and the pre-survey, had some significant symptoms, right? Popping up in red there, we've got vomiting, diarrhea, and hair and skin issues, as well as some constipation and excessive licking. So pre-test showed us that, yes, zonulin is an issue and actually borderline. So trending in a not healthy way, trending toward that red stomach issue with zonulin. And over the course of the protocol, they were able to get it under control, which is great. You can see the anecdotal data that the symptoms were resolved. Vomiting went from 5 to 1, diarrhea from 6 to 0, right? Constipation 4 to 1. Excellent, excellent. With hair and skin as well, symptoms were resolving, and the excessive licking. And you can see in the data point on zonulin went from 2.69 to 0.52, which is excellent. That's what we want to see. We want to see those junctions tightening up, the permeability getting stronger. So this guy is clearly feeling better, right? He doesn't have symptoms. And we know based on the test that his gut is actually better. He is healing. So
oh my gosh, this is so exciting. And what's really interesting in comparison to Graham is that these symptoms were pretty severe, right? And yet the zonulin levels, the leaky gut, wasn't actually even as high as Graham's testing was. So that's really interesting. But I really love that some of these numbers, like diarrhea, went from like really bad to gone, vomiting, constipation, excessive licking. We had no expectation of a cat with excessive licking that our IBD gut restore kit would actually help, because we always think of just the gut, so we think diarrhea and vomiting and constipation and things like that. We don't always think about the other things that you often see with leaky gut, which is excessive licking, hot spots, things like that.
Or even just the self-soothing of it, for a cat that is not feeling well internally. I remember Dr. Judy Morgan saying once, you notice your cat licking a specific area constantly. If it's their tummy, maybe they don't feel well, or if it's their leg, maybe there's some arthritis. So that too could be part of this, just feeling overall.
Yeah, it's so true. With gut issues, there's a stat that it's over half of all vet visits are related to symptoms associated with GI issues. Now we think of the obvious ones, right? Like diarrhea, constipation, but it's a lot of times those not obvious ones. The licking, the skin, the allergies can all point back to imbalances and issues that are happening in the gut as the root cause. And like you just said earlier, then they go through like a normal protocol, you could be really getting some damage before you're doing some good. So
I think it really does speak to as well the power of testing. When we go to the vet, we know that there's an issue, so we're going to the vet for that issue. Ideally, we're going to have a journal of when this concerning issue started, how it is progressing, whatever. Imagine if we were also armed with this kind of data where we can say, hey, this could actually be, his Zonulin's really high, or whatever it may be, and ask the vet to, work as a team. So much of this is complementary, right? There's always going to be a need for conventional medicine and all of that, but to be able to add this knowledge on top of it, and be able to see, this is so exciting, that there are things that we can do that have zero harm and can really help some of these really difficult situations.
Yeah, and knowing that it was 75%, obviously you guys know me specifically, and I am so like OCD. I look at the results and I'm like, oh, there was one that didn't work, instead of like all the ones that did. But here's the thing,
that is
guys,
what we spent the most time talking about.
Yeah, but here's the thing, and we said this to you guys also from the very beginning. We said we do not want to leave these cats behind. It's really sad for us. I know that we love our product line. We support it. We want people to use the products, but we're not just here to sell a product. We're here to help cats from the inside out, from the beginning to the end. We want to help cat parents best understand how to help their cats. And so giving them supplements and telling them not to change the diet was really hard for us. It was really, really hard because we saw
it was in the name of science. So yeah.
Right. Yeah. That's, you guys talked us into it, because it was like, but they need to change the diet too. But it was important because you need to know how will supplements help.
Yeah.
If everybody changed the diet at the same time, then we wouldn't know if it was the diet or the supplements that actually helped. And now to see these great results with just the supplements, we are going to be coaching everyone on how to get that diet switched over now, so that we can help them, moving forward, not just their supplements, but now let's get the diet under control, and knowing that, some of them were just small increments of improvement, but we could get that to 100% improvement. I truly believe with the right care and the right diets.
No, I mean, you just hit the nail on the head too. And you guys have heard me say this all the time, and I repeat it. I always want to meet a pet parent where they're at, right? We're providing information and tools, and information is really powerful. And so, like you said, like it is hard when you're like, I have all these new things I can tell you and what you could do, but then you see the data point on the line and you see the symptoms resolve. And even if it's just moving it from bad to borderline, and then having that next step, that motivation to say, okay, now I'm ready for that next big change. Because sometimes that's overwhelming. You're like, wait, I have to add this and that, and this is all new and I'm uncomfortable. And, it's just meeting them along the way and helping nurture that. So
I have to say, we're so grateful for your guidance on this too. This was, just an amazing opportunity to be able to work with you guys and have this community of cat lovers that we get to be a part of really step forward and want to participate in this kind of research was amazing. But your guidance along the way, having so much experience in this sort of thing, of what it is, what questions to ask, how to ask them, when to do the follow-up surveys, how to kind of gauge that anecdotal information, as the whole thing went along, like, yeah, Jay and I are not scientists because we're like, oh, let's do 15 things right now. And it's so amazing, exactly like you said, to start kind of like the baby steps. Like,
Yeah.
for so many of us, we don't even know this was even possible, that we could test to see, oh, hey, is there something going on in the gut that is going to be, that will help solve this food sensitivity issue, or whatever it is that may be going on that we've really been struggling with in a cyclical way. So many of the cat parents that we talk to, they have been dealing with some sort of IBD issue, which, you know, there's Jackson Galaxy calls IBS issues. Like, you just throw in a bucket all of these things that relate to the gut.
It's inflammation.
It's basically, I mean, in the human world, you're given the diagnosis of IBS when they don't know what else it is. And you're like, what's IBS? Well, you know, it's an exclusion type of thing. And so it's the same for the pet. I'm like, when you just don't know, and, you know, it's like, well, IBS then, I guess. So,
right.
It's that word, you know, it's, you know.
And it's hard to know how to treat it. So, and you guys are actually coming up with, you know, by doing these tests and working with different companies and finding out what is, you know, what's working. It's you guys are literally becoming the answer to pet parents everywhere, because it's the number one thing that cats and dogs deal with, right? Are immunity issues of some sort. And the number one reason why vets throw their hands in the air, or, you know, end up with $1 million not $1 million, but thousands of dollars in testing and still not having an answer. So we're so grateful to you guys. Like, so I could cry. We're so grateful to you guys for all of your help, your guidance, and for all the hard work that you put in to figure out. We were with you. Poor Lucy, she was like, okay, we need to ask this question and then this question and then that, and taking notes all the time.
Amazing, just the amount of work that went into this. Will you, for anyone that is just watching this and they really don't have any idea that there is such a thing as testing for any of this kind of testing, what you guys do?
Yeah. Well, I just want to say I did put the link in the description here for anybody that wants to get their test from Innovative Pet Lab, the only company that's doing this type of testing for pets, and also our link to our IBD and Gut Restore kit if you guys are interested in doing any of this. But go ahead.
But could you guys? Go ahead, Lacey.
No, that's fine. I was just going to say, yes, join our newsletter, because we have some very special holiday things coming out tomorrow. And if you're on our email list, you can be a part of it. And we're here for the data and to help cats and dogs. And every cat who gets tested helps us grow our data pool, helps Dr. Betsy Redman in her need to just get in research every single day of her life. When this research came out, she was just like, oh, I want to look at this subsection and I want to see if these, symptoms correlate with this number. And she's just like,
there is still things we're doing. Yes, there is still a thing that she's pulling from this that we'll continue to share and correlate. Like, it's so exciting to get. So,
and we're sorry that she's not here with us today because she is not feeling well, but it is fascinating. Her brain works in such an incredible way. And when you look at these, all the data that's in there, to be able to organize it and then to really start looking at, I wonder if there's a correlate. The work that you guys are continuing to do with this body of research is so exciting. So I'm sure we're going to do this again. But for anyone that has no idea what testing is, how it works, the different tests you have available, and kind of just an overview for anyone who's jumping to your site right now to go sign up for your newsletter, explain a little bit about the tests themselves.
Yeah, so we have right now 3 tests for cats that are available. There's 5 for dogs, 3 for cats. It has nothing to do with liking dogs more, I promise you. And it comes to how committed we are to actually putting out quality testing. One of the testing when we validated in cats, we just didn't love what we were getting as far as how they all fell in a reference range. So we actually still study it in the back end. We don't release it for cat parents right now because I don't want to give you information that may not be meaningful. And so we have not, for that one reason, launched a digestion and detox test for cats. That one's the one on the back end that it's still in research. But right now you can do an inflammation and immunity test, which looks at markers around, it's called calprotectin. It's probably, or, not that I have a favorite marker. I don't play favorites. I told you guys, but this one is really great because what it does is actually measure the level of inflammation. And why that's really important is if you think about it, say, inflammation, like if you have a cut, that's an inflammatory response to it, right? I cut my arm, It's bleeding, it hurts, there's some inflammation coming, and that's a response. So say you have a cut inside your gut. And it's one thing to say, yes, you have a cut, yes or no. But it's a totally different thing to say, yeah, you have a cut and it's just this big, or you have a gash and it really needs a lot of support. And that's what we're measuring. It's quantitative. So it tells you how much inflammation is there, which will change the way you should treat, right? A little inflammation, we can do diet, we can do supplements, we can make lifestyle modifications. A lot of inflammation, that is a do not pass go see your vet. It is time for the big workups. Let's diet because something there is really off. The other test we do is the leaky gut one, which we spent a lot of time talking about. So, looking at zonulin, also looking at reactions to gluten and how the body's reacting there. So it gives power behind if your pet's having that kind of response, a diet response. I think Lacey has a kid that just jumped in. Fair warning, Lacey and I have children. They appear at moment's notice, so we cannot control them. So it's really those two tests that we're looking at. And then we have a basic gut. And the basic gut we brought to market because sometimes parents, pet parents are just like, I want maybe one of each. And so one of the leaky gut ones and one marker from the inflammation immunity. And I just want somewhere to start with the basics. And so that's what we created that test for. There are some fun things coming out in January. So another reason to join our email list, not for the amazing surprises that are coming tomorrow, but also because you'll be the first to know when we launch some new cat stuff with some new markers that are in R&D right now and some other things that we hope to do with you guys. There's more to come, but that's currently what's on the market with us.
Yay. Oh my God. I'm so excited. I'm so glad I've signed up already for your newsletter list.
It feels like Christmas.
Yeah.
It's so amazing the work that you guys do and the motivation behind it and all the, I don't know. It's just, it really is changing the world.
Yeah. It's so needed in the pet world. And I'm just so glad that you guys decided to do this and are so immersed in the pet world so that we, as just little peons of pet parents can have access to you guys and to your information in your test. So thank you guys so much.
Amazing resource.
Again, thank you guys all who participated. Stay with us. We have a lot more information and help that we're going to be offering you guys for helping your cats get even better from here on out. So thank you, ladies, and thank you, everyone, and thank you, Erin, for giving your story. And we will see you guys tonight for Q&A. Mwah.
Thank you so much.
We'll see you soon.